We've seen a major uptick in cases of the bird flu in recent weeks. And now a new report from Newsweek reveals the CDC is on high alert and searching for pandemic red flags. The CDC's last update shows there are 66 confirmed cases of bird flu in the U.S. Confirmed cases have also been detected in 915 dairy herds and more than 129 million poultry. Joining us now for more, primary care physician and public health specialist, Dr. Saju Mathew. Dr. Mathew, I know you're in Atlanta. You're seeing different cases, and you're following this like we are. It feels like we hear about viruses all the time, but these bird flu cases continue to pop up all across the country, namely in California and places like that. What should we know?
Well, Nick, here's the deal. So far, most of the cases have been amongst poultry workers, commercial farm workers, and they are constantly exposed to the bird flu. This one severe case in Louisiana is what's concerned public health officials like me, because that is the first severe case of bird flu from dead birds in that patient's backyard. So the question now remains, is the virus mutating so easily that it's penetrating the human body? And next, will there be a case of human to human or person to person transmission? But I want to be clear, the average risk for a person in the community is still low. If you're not working with wild birds or poultry, your risk for the bird flu should be low. But we need to be absolutely sure that we're sequencing these viruses and paying close attention to the mutations.
And Dr. Mathew, you're used to viruses. You expect a virus to mutate over time. You're just worried about the speed of it possibly and how it is spreading. There are a number of ways to become infected. A big concern is that that infection could occur through our food chain. Now, according to the CDC, the public health risk remains low. Like you said, no infected birds or products will be entered into the commercial food chain. When it comes to poultry, though, and eggs, any chances that it could affect the things that families consume, and are there any changes that families should make?
Ultimately, when you think about decreasing your risk, the average risk for an average American family, you want to make sure you avoid raw food. You want to make sure that you are pasteurizing your milk. Avoid raw milk. And in the cases of the number of cats that have also gotten the bird flu, if you're a pet owner, try to keep your cats indoors. And again, always make sure that it's commercial pet food and that we're all avoiding raw milk. Those are some of the steps that the average person can take to decrease the risk.
Dr. Mathew, I know you practice family medicine. What are you telling your patients who a concerned parent comes in and like, my kid's been coughing, I'm really worried here. What should people do? I have a minute left and I'd like for you to give us something we can take away.
Well, here's the deal. We have vaccines. We have vaccines against RSV. This is still the time where you can get vaccinated against the flu, COVID-19. So if you're sick, the most important thing is to obviously see a doctor. There are remedies. There are antivirals for a lot of these viruses. But I'm telling you right now in the emergency rooms, we are being swamped by these 4 viruses. Mostly wear a mask if you're in congested spaces, wash your hands, and it's not too late to still get vaccinated.
Dr. Saju Mathew, thank you so much for joining me this morning.
You bet.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.